Cardiovascular diseases remains the leading cause of death worldwide, claiming an estimated 17.9 million of lives each year, a staggering 32% of all global deaths. Even more concerning is that the heart attacks alone accounts for 85% of these fatalities. These numbers aren't just a statistic, but they are the wake-up call for us. Heart attacks often occur without warning, catching individuals off guard in the midst of their daily routine. So, in today's fast paced world, where high pressure jobs, constant deadlines, and stress have become a norm, the risk is only growing. It's a silent epidemic that demands urgent attention, and conversation around the prevention, awareness, and timely care are more vital than ever. Today, we are honored to welcome Dr. A. Vasantha Kumar, an esteemed interventional cardiologist from Kurnool. He will shed light on the crucial topic of identifying typical and atypical symptoms of heart attack and what to do about it. In this session, Dr. Vasantha will be offered valuable insights into recognizing early warning signs and taking timely actions to potentially save lives. Dr. Vasant Kumar is an MD, DM in cardiology, means is a highly respected and accomplished interventional cardiologist with decades of dedicated service in the field of cardiology. He brings a wealth of experience in diagnosing and treating a wide spectrum of heart conditions with precision and care. Over the years, he has successfully performed numerous complex cardiac procedures, earning the trust of patients and the respect of peer alike. Currently, he is associated with Sri Vijayadurga Cardiac Center, a multi-specialty hospital in Kurnool. He continued to deliver cutting-edge cardiac care while mentoring young medical professionals and contributing to the advancement of cardiovascular medicines in the region. So before proceeding further, Dr. Vasan, would you like to add something from your end?
Yeah. Good evening, all. Thanks for the kind introduction. Uh, what you have said is absolutely true. And if you look at the statistics in India, they are staggering. Among all the deaths now, you can say cardiovascular diseases is the number one killer, both in India and China, and we lead the population in the world. And you can imagine the statistics it can cause. And being born as an Indian itself gives you certain disadvantages like a high prevalence for these diseases in India.
Yes.
Thank you.
Thank you so much for the kind introduction, Doctor. We'll start with the conversation. My first question to is, what are the most common, or we can say typical symptoms of heart attack?
The first thing people consider while they experience heart attack is that they have pain. Many of the patients who come to the casualty or go to a clinician say that they don't say pain actually. Many of them say discomfort, chest discomfort, uneasiness. And depending on the local languages, they use local terms like some of the communities use niti dara. Then some people use as if an elephant is sitting on the chest. If somebody has a discomfort starting from lower jaw to the navel, that is umbilicus. Discomfort anywhere here could be because of heart attack. So if you recognize the symptoms of heart attack early, if somebody develops chest pain, chest discomfort, burning, uneasiness, tiredness, sweating, unusual sweating, you are sitting in an AC room and you are profusely sweating,
Yes.
then unusual breathlessness, vomiting, nausea, unable to do any work. All these are some of the symptoms. And if somebody has a chest discomfort lasting for more than minutes, 3 to 4 minutes, the nature of it could be what I said, like gripping, pressing, the stabbing pain, transient pain, pains, discomforts that last only few seconds are not usually cardiac. So they are all non-cardiac. Once they have these discomfort, if it is associated with sweating, starting from lower jaw to umbilicus, then if this person has any history of sugar.
Doctor, you're not audible. Hello? Hello, doctor? Sir, you're not audible. Doctor? Hello? Hello, doctor? Sir, you are not audible. So I'm not able to hear you, doctor. Can you please disconnect your Bluetooth device? Hello? Not able to hear you, sir.
Hello, am I audible
Yes,
now?
sir. You're audible.
Thank you.
Yes, yes.
So, uh, any discomfort which is associated with sweating, profuse sweating, breathlessness, starting from here, going to the left arm, going to the jaw, and up to the umbilicus, if they have this sort of discomfort, you can consider that it could be heart attack.
Thank you so much, doctor, for this information. Likewise, what are some lesser known symptoms or the atypical symptoms that people may often
See, many
ignore?
of the times people consider that a chest discomfort could be a instantaneous tearing pain, as if you see in a movie patient, person clutching the chest and falling down on the ground. It rarely happens, but most of the times it is a continuous pain, increases on exertion, reduces on rest. Sometimes it may not come down. If any chest discomfort which doesn't come down and continue to stay more than 10 minutes, be careful that it could be one of the warning signs of heart attack. So, along with this chest discomfort, people have unusual tiredness, sweating, vomitings, and vague discomforts in the back, in the abdomen, upper abdomen, especially women, elderly, diabetics, and say they may not be able to have, they may not have typical symptoms of acute heart attack.
So you have tell about the women's also. So how do heart attack symptoms differ in men and women?
Yeah, it's a very important question because in our country, the women population, especially the diabetic women, obese women, people who are not exercising, these people are getting heart attacks at an earlier age. See, women have a protection for heart attacks from menarche to menopause. That means when they are menstruating in the reproductive age group. But once the estrogen effect is gone after the menopause, their their incidence of heart attack is as good as men. And women actually have a higher uh, capacity to withstand the pain, and most of the times they do not tell that they have a discomfort. Many of the times they ignore, and sometimes even if it comes in the middle of the night or after 10 o'clock anywhere in the world, including US or other countries, they don't disturb the family members because you are looked upon as if you're creating a scene by saying that chest discomfort. And most of the times they try all the homemade measures like taking some sodium bicarbonate or sodas or vomit themselves, and if still the discomfort doesn't come down, they see this. And that pattern of nausea, vomiting, unusual sweating, breathlessness are more common in women. That is the reason why note they identify the pain or discomfort later, and they present to the hospitals later. Even in the hospitals, they don't get as much attention as a folk in the casualty, because many of the times they underestimate the severity of the symptoms as well as signs. And once you diagnose somebody as a heart attack, actually women have a bad prognosis compared to men in many of the aspects. And the amount of testing a man undergoes, like ECG, echocardiogram, coronary angiogram, or stenting or bypass surgery, all these things are less frequently done in women compared to men.
Okay, so it's like a major call for all the hospitals that women also should be treated equally, or that they could see the
Yeah,
symptoms similarly.
the
Like
triaging
the
should be faster, and you should not neglect that it's just a woman or some vague pain, and we should not think like that. The triage should be faster so that you don't miss the patient diagnosis.
yes, definitely. Doctor, my next question is: can a heart attack occurs without chest pain? So, how
Yeah,
can we
many of the
recognize it?
times people think that what they have is a gastric pain. And I think in India, with all our spicy foods and uh, binge eating, if somebody says gas, I think you should exclude first heart attack or myocardial infarction rather than gas problem, because usually the gas problem doesn't kill you, but the myocardial infarction, heart attacks can kill, especially in the first few hours. It is the sudden cardiac death before you even reach the hospital, people die. And sometimes, especially in women, the vague presentation, in elderly, it could be silent attack, and especially so in diabetics. Sometimes they don't have pain, they have symptoms like sweating, weakness, tiredness, unusual loss of interest, and dizzy. So these such symptoms, which can be thought of as a diabetic problem like sugar or low sugar, and because of that reason, sweating also is considered as part of low sugar, and that's the reason why these people don't come to the hospital as early as other patients.
Okay, doctor, you have said much more about the symptoms till now. So, are there any early warning signs that a heart attack may be coming days or weeks in advance?
At this moment, we exactly can't predict the exact moment when the heart attack occurs. But mind you, if somebody has chest discomfort, suppose he's walking 1 kilometer, he used to get chest discomfort on exertion, or climbing 2 floors he used to get. Now at rest he's getting, or when taking bath he's getting. Even on minimal exertion he is getting the symptoms. And earlier he used to take one sorbitol tablet under the tongue, it used to subside. But now it is taking 2 or 3 tablets. So even minimal exertion at rest, if the discomfort is not coming down, earlier it used to last for 3 to 5 minutes, now it is lasting more than 10 minutes, 15 minutes. So if any chest discomfort doesn't come down by 15 minutes with all your measures, I think it's time that we should realize that it could be a warning attack and we should seek medical help.
Okay. Doctor, my next question is what are can young people or those who are physically fit can still suffer from
Yeah,
heart attacks?
that too happens. You must have seen cinema actors, gym people who are working in gyms and working out. They also can suffer if they don't have realized that the symptoms they have is could be cardiac problem. And sometimes unusually some people strain more than what they can do. So severe exertion, severe emotional stress, and taking drugs, especially the cocaine and all these drugs, and smoking in young people is one of the cause which can precipitate heart attack in persons who don't have any disease earlier. Like sniffing cocaine can cause myocardial infarction by causing narrowing of coronary arteries, the blood supply to the heart. So young people, fit people also can get. But actually, the young exercise prevents heart attack. But if you do things extreme, it can cause. That's the reason why you see people collapsing on the ground while jogging or doing marathon or doing exercise in the gym, lifting unusual weights. So that we should not do.
Yes, thank you, doctor, for this information. Doctor, my next question is are there any lifestyle habits or symptoms that one should monitor regularly to prevent a heart attack?
That's a very important question and often neglected by both patients as well as doctors because prevention is better than cure. So the how can you prevent heart attacks? We have anything some formula? Yes, you can call it formula 100. Walk 100 kilometers per month. That means 3 kilometers, 3 miles per day or 3 kilometers per day. Then keep your blood sugar below 100 fasting. Keep your blood pressure below 100 and regularly exercise. And most of us, in spite of having diabetes, hypertension, uh, family history, you can still survive up to 100. Taking a vegetarian vegetable diet, less in fat, meat, lean meat, and less dairy products, and more of fruits, leafy vegetables. This diet is called DASH diet or Mediterranean diet, is one which can prevent the clot formation, the atherosclerosis formation in the arteries. Then, if somebody has regular walking, yes, that also reduces. If somebody does regular yoga, meditation, all these things cannot prevent, but they can postpone or delay these problems. Then controlling your sugar, controlling your weight, not take smoking, not taking excess alcohol, all these measures will definitely help. Lifestyle measures will definitely prevent us from getting heart diseases.
Thank you so much, doctor. Lastly, do you have any message or advice from your side to our audience?
Yeah, I think we all should get a proper regular checkup of your blood pressure, sugar, cholesterol, especially so if you have a family history of heart attack, sugars, and blood pressures, and high cholesterol, everybody should do. I think all children above 13 years, especially if they are obese, should have a proper check. Now we are checking the blood pressures only when you are entering your college or probably in your job. That's too late. We should start less than 10, 12 years, have a checkup once, and then if obesity is there or if any family history is there, you be careful that you have a regular follow at least once in 5 years if it is normal. Have a especially people who are diabetic, obese, and all the habits, if they have bad habits, they should be careful and try to have a regular checkup, and then probably some preventive tests like ECG, echo, 2D echo, and uh, treadmill test sometimes can guide you uh, in going for a proper treatment.
So, with this note, as we come to close of today's enlightening session, our deepest thanks to Dr. Vasantha Kumar for sharing his valuable time and expertise, also your advice, sir. In this clear
Thank you.
guidance on recognizing early warning signs of heart-related emergencies and understanding the symptoms that often go unnoticed has been both eye-opening and empowering. Also, to our audience, thank you so much for being a part of this important conversation. We hope today's discussion encourages you to stay proactive about your health, especially the heart health, and attentive to change that might otherwise be overlooked. We look forward to bring you more such expert insights in the future. Until then, take good care of your heart and don't forget to follow us on the social media platforms for more such updates, tips, and wellness inspiration. Dr. Vasanta, once again,
Thank
thank
you.
you very much for joining with us. Have a
Thank you.